All right, hello everyone. So we are group 9 and our presentation is on the use of ferromagnetic nanoparticles in the treatment of glioblastoma. Now, before we get into what all these fancy words mean, we wanted to introduce ourselves as a team. So my name is Emma McGangus.
I'm Aslesha Pathak.
I'm Jake Robbins.
I'm Aditya Pinjala.
I'm Nasir Taylor.
I'm Taryn Donahue.
I'm Ogna Birshtanita.
And my name is Nyan-Su Chen.
All right. So now I wanted to do something really original, never seen before. I wanted to start by asking you guys a question. So by a raise of hands, who in here has been affected by cancer? This could be either a loved one, a personal experience. All right, so look around, look at all the hands. Okay, now a follow-up to that. How many have lost a loved one to cancer? Again, a lot of hands. And this is actually because cancer is known as the second most leading cause of death in the United States. Now, if we shift the lens specifically to brain cancer, there are specialists in the field who have predicted 18,000 deaths for this year alone, 2023. Keep that in mind as you hear our presentation.
So glioblastoma multiforme is the most common form of brain cancer. Stemming from astrocytes, it is rapidly multiplying, making it one of the most deadly cancers known. So treatment for glioblastoma is not dissimilar to other forms of treatment in other forms of cancer. So it's usually surgical resection followed by chemotherapy and radiation. Now, the problem with this is because glioblastoma rapidly multiplies, it often invades healthy brain tissue, making surgical resection really hard. And radiation and chemotherapy make patients very sick. So there has to be a better way. But the problem with the brain is due to the blood-brain barrier, which lines blood vessels and is made up of tightly packed microvascular endothelial cells, it's hard for things to get in and out of the blood-brain barrier, which keeps the good things in and the bad things out. So how are we going to get past this issue?
Here's where we introduce ferromagnetic nanoparticles. Now, as Aslesha just said, the blood-brain barrier has been keeping nanoparticles and drugs from directly entering the brain and targeting these glioblastoma. So researchers have found a way to bypass the blood-brain barrier problem altogether by using ferromagnetic nanoparticles. How does this done? Through intranasal drug delivery system. Essentially, these nanoparticles enter through the brain. You can follow the blue arrow, or through the nose, through the olfactory and trigeminal nerves, and into the brain, where it can be magnetically manipulated to the intended destination, which is the glioblastoma.
It is important to understand the structure of the particles. So the particles are linked with a pH-sensitive bond to the cancer-treating drug, and the particles themselves are made from iron and platinum. Once they enter the cell, the acidic pH causes the break of the bond, which releases the drug, which induces apoptosis, which is cell death, and the iron which was in the particles is cytotoxic, which causes reactive oxygen species to be generated, which later also induces apoptosis. There has been already done studies in mice which were successful, and now there are ongoing trials in humans.
So our research question is, what are the implications of using ferromagnetic nanoparticles to treat glioblastoma?
Nanoparticles, as we've already spoken about, have many benefits. They are effective in treating GMB, glioblastoma. They kill cancer cells, and they, however, also damage other aspects of the body. Studies in mice, like we've already spoke about, cause neurodegeneration, which develop brain dysfunction caused by iron deposits. In other studies, they use GPX4, which is an enzyme that regulates ferroptosis, protecting non-GBM cells from death. But they also use eracin, which is utilized in ferromagnetic nanoparticles in cancer treatments, which when it inhibits GPX4, results in strokes and iron depositions in the brain. Also, neurodegenerative disorders. Another study shows they use XCT, which is a molecule important in metabolism in cancer cells. And this leads to nerve dysfunction by interfering with myelation, which is crucial to transmitting electrical impulses in the brain.
When these neuroparticles are metabolized around the brain, and if there's an excess of them, they can cause a dopamine drop in the brain, or a dopamine production drop in the brain, which can cause low motivation, tiredness, and other side effects. When the iron oxide is metabolized and dissolves, it produces ROS, which is reactive oxygen species, which can interrupt the signals between organelles in the cell, which can cause abstract cell function, and the body automatically tries to oppose this. But if there's an excess of these cells, it can cause oxidative stress, which can lead to cell death and growth in neurodefective disorders.
So historically, impoverished communities and racial minority groups have lacked access to cancer treatment due to the rising cost of healthcare. And people of color are more likely to be uninsured and face further difficulties in pursuing cancer treatments. So what this means is that usually these uses of nanotechnology are only going to be confined to developed countries because they have stronger infrastructure and more ability to research, and they have greater research institutions. So manufacturing nanomaterials and the cost itself for nanomaterials are quite pricey. But even though this is the case, advances in the neurotechnology have potential for cost-efficient nanomaterials, and due to the high precision of these drugs, small amounts of the drugs are going to be needed, which can further reduce the cost. So while for now it is expensive, it's actually predicted to be cheaper than typical chemotherapy. So it is still important to remember that measures need to be taken to make sure that all social groups are able to have access to this potentially life-saving treatment, which is in the near future.
So our proposition would like to suggest the treatment and dose of the medication. And we would like to follow the principle start low, go slow, which entails the clinician or the doctor to have higher capabilities over like controlling the drug and the treatment and mediating certain parts of the treatment. It also gives greater agency and agency to the patient. Also, neurodegeneration is another problem that we have to face. And we can also address this using start low, go slow. And this basically allows, or this is caused by long-term neurotechnologies that have been in the body for a long time, and we're like unsure of the consequences so far. So these are like future consequences or impacts. So we can address this by, start low, go slow, because we can like we could address this by start low, go slow, because we can slowly and systematically address these issues. And we have to remember that this is a new field, and there are new developments coming out every day. So we have to think about it in the greater context of saving lives. So we would also like to suggest a resolution. Currently, there's a lacking legislation in the field of neuroethics, neurotechnology, and nanotechnology. We need clinicians and doctors to have a legal framework, a legal, even social or even ethical framework to understand understand patients and treat them the way they deserve to be treated. Because there's questions about consents that haven't been addressed by everyone yet.
It is evident that this nanotechnology has the potential to help millions of people. However, we must consider what patients would be receiving this treatment. Glioblastoma is an aggressive form of cancer, meaning the patient is terminally ill. Considering that the patient is terminally ill, what threshold of off effects will we be willing to risk to treat these patients before we start to hurt them more than we're helping them? Start low, go slow is our proposition, but people could propose ideas such as, well, is this giving a false sense of hope? Will it lead to pessimism? Will it lead to people discontinuing the treatment? And what I can say to that is, doesn't every treatment for cancer have potentials to have pessimism or false senses of hope? In the same sense, we could look at the off-target effects, and is that damaging our patient more than it would help them? Well, look at chemotherapy, radiation therapy, invasive surgery. It's damaging all the surrounding cells as well. So if this has a higher probability in the future to treat glioblastoma without as much damage because it's targeted, would that be better to continue? It would be better to continue to pursue that instead of continue with damaging radiation therapy or untargeted chemotherapy.
All right. As we discussed, the ability to administer treatment that can bypass the blood-brain barrier as a whole has opened up a world of opportunities for treatment in the field of neuro-oncology. Now, based on the promising therapeutic efficacy of these ferromagnetic nanoparticles, we are pushing for further research and development into establishing this as a primary form of treatment, as well as regulating safety and logistics procedures. And one last thing we wanted to say, one big thank you to everyone for listening and everyone who's helped us in this process. And yeah.
Great presentation, great topic. Speaking as somebody who has undergone cancer treatment, these issues are really real. And I think one of the things I really liked about this is you covered a nanotechnology, and I think there's a tendency with nanotechnology and other things in neuroethics to jump because it's a new technology, to ask questions about it as if this is the first time we've ever seen this kind of an issue. And I like that you actually asked the question, what about this is different from other cancer treatments? And is there in fact anything different and anything we should be considering differently from standard cancer treatment and kind of the clinical ethics of that? And in it so far as part of your answer was no, I really salute that as an approach that you took. Beyond that, the issue of off-target effects, very, very important, very real. For something like a glioblastoma, you asked the question of if there's neurodegeneration from the neuroprotective effects that needs to be, or medication in order to apply the nanoparticles, which is better essentially. If you're going to be dead or living with the effects of a stroke, it's not the first chemotherapy to have neurological damage as a side effect. So great job, great presentation. Good job, guys.
No, I agree. I mean, very, very well done. What I really liked was the handoffs. Again, what you did is you said, this is something that could be done. We have the technology. Is this a viable pathologic target? And the dialectic was particularly well done. And so a real vote of applause on that dialectic, saying we could do this and this would be a bad effect or an adverse effect. But what about this? So comparing the possibilities with regard to its adverse effects to the adverse effects of currency, I think was very, very nicely done to be able to open the windows of possibility and probability to say, okay, is this an entertainable proposal with value as it relates to something we're already doing, which is part of something, a larger approach called a Heilmeyer Catechism. What are we doing? Does it work? Why doesn't it work? What could we do? And is it effective and efficient across a number of domains? Good job overall. Just
Great presentation. I particularly liked how you had a very clear proposition that was kind of encapsulated in that start low, go slow. Like that you had a really like even a a term for it, that really encapsulated this cautionary stance that you have, which is what you're proposing to balance the potential risks and benefits. And it's a very clear, you clearly argued it. And then you had, as Dr. Giordano said, I liked in that dialectic part where you really anticipated counter arguments to the proposal that you had, and then gave your responses to that. So well done, very well organized.
Agreed. And you guys, you could have picked a lot of different sorts of diseases for their candidates. You picked a particularly brutal kind of cancer, but you know what? You approached it in a brutally honest manner. This was straightforward, no holds barred. Every corner was poked into, every shadow was shed some light on. So that is to be applauded. And so I applaud you.